So we're looking at the next congenital issue. This is what is known as the congenital dislocation of the hip. Congenital dislocation of the hip. Alright, so some people call it what? Developmental dysplasia. It's still the same thing. Alright, so for congenital dislocation of the hip, it's also known as developmental dysplasia of the hip. So it's just a condition where the joint, that's the hip joint, is improperly formed. Alright, it's not properly formed. So it will lead to all sorts of instability, and dislocation could also occur at the femoral head from the acetabulum. Alright, so it can occur before, during, or maybe shortly after birth. Alright, so early dictation is very key if you want to actually prevent long-term complications. So what are the causes of congenital hip dislocation? Causes could, the exact cause is not really known, but there are some risk factors, a group of individuals that this is like occurs most likely in them. So genetic predisposition, so a family history, all right, Breech birth position, firstborn status, female sex, so it actually occurs more in the female children. If there's low amniotic fluid right there, all right. So signs and symptoms is asymmetrical thigh or gluteal folds. All right, like the thigh is not, the level is not at the same place. Limited hip abduction, leg length discrepancies, clicking or clunking during hip movement. All right, so that shows that there's a positive Ortolani and Barlow test which we'll be looking at. Then limping or waddling gait in toddlers. So diagnosis is physical examination at birth, during well baby visits, okay, ultrasound, x-rays, right, used for 6 months when bones are more ossified, used after 6 months. So treatment options is all of this, 0 to 6 months pelvic harness, 6 to 18 months closed reduction under anesthesia, spica cast, more than 18 months open reduction surgery, possibly with osteotomy. Older children may require hip reconstruction or replacement. So long-term outlook is early treatment leads to excellent outcomes in most cases. If it is untreated, it can lead to early onset arthritis, chronic pain, and such a person will grow up having a lot of problems moving around. Okay, so that's just it for congenital dislocation of the hip.